Happy Saturday. Feeling a little extra super today. And 34 weeks, so getting really, really close. So I was reading some articles this morning, and one of them that I came across in AJOG discussed using POCUS or point of care ultrasound in order to assess for fluid responsiveness in pregnancy. And this is a clinical expert series, so it's not, like a randomized control trial. It's sort of based on people that do this a lot, but still really, really interesting stuff that talked about how to incorporate that into your clinical assessment. Because especially in certain conditions of pregnancy, such as preeclampsia, right, where you're super concentrated in your vessels, but you are extravasating all this fluid everywhere else. So as you pour fluid into those patients, it's going in their lungs, it's going in their peripheral tissues, it's not going where you want it to go. And they still end up looking really dry, like having low urine outputs, having tachycardia, just not looking well overall, but you're not helping by adding more fluid to the problem. In fact, they said about 89% of women with preeclampsia were not fluid responsive when you looked at a challenge of fluid, or if you were actually looking with ultrasound. So how do you look with ultrasound? You assess the IVC or inferior vena cava for collapsibility was what they talked about. Kind of hard sometimes when you're pregnant, right? So they also have an algorithm for when you don't see it well, but also this can tell you if fluids are not the right answer, which would be super helpful. Highly recommend reading it. Have a good day, guys.